Everyone, this is our project Bert Hellinger, and this is our fourth live. I've just finished the live in Portuguese, and this time we're gonna get started in English. So some of our guests speak English, and then we do it in English. Some of them don't speak English, and I translate simultaneously. So right now we're gonna do fully just English with Dr.Adailton Meira. So he's a gynecologist who is also a homeopath, a constellator, and he also works with acupuncture and the 5 biological laws. So I was saying before, because I have been working with women's health for 14 years, it's been so inspiring to see medical doctors actually talking about integrative health, how to bring holistic medicine into mainstream. And I have signed up to one of his courses where he talks about the languages of illness. And this is very inspiring for us, is to contemplate how, as doctors or as professionals, we can actually integrate something that goes beyond the matter. So he's here now. I will welcome him in. I will be able to talk directly in English. Oh, did I go? Maybe now. Yeah, hello, this is our English time.
Yeah, thank you for calling me and inviting me for this moment. And I'm ready.
Let's go. Thank you. Okay, so I give a brief introduction. And one of the things that I actually wanted to ask in English, because it inspired me so much when you said about training in France, and meeting Michel Audin and Janet as well. And because I was always very fascinated about the world of conscious conception and natural fertility and things like that, due to my own inability to get pregnant, I struggled for 5 years. And it was only when I integrated natural health into my life, liver flushing and then diet with Ayurveda, with looking also into my emotional life, my spiritual life, like literally having to transform my life so much, that I finally got pregnant. And I actually, in this house, I had all my labor at home with the water. And I remember that time how I wanted to go to France and study with Michel Audin. And then I got pregnant, and then he fell from the stairs, so then didn't feel to flow much. So eventually I had to be transferred to the hospital, and my daughter had the umbilical cord wrapped twice around the neck, just like me, just like my mother. And then later on, when I got in connection with Family Constellation, I could start to see the repetition of pattern, the similarities. So I wanted to start asking that, how was for you to actually get to connect with them as part of your career as a doctor, but also translating the active birth book into Portuguese? So I think that that's such a big thing. So how was that experience for you as a man, but also as a doctor, no, as a human being, but also as a professional?
Okay, well, I had an experience in my early training when I was in the university to be present in a home birth. And this happening left an imprint in my soul as an inspiration. How could a birth be? How wonderful, how spectacular can be the moment of when the baby is born. It's a magic and very important moment. I had in my life my own experience, the importance of the trauma at the birth. First thing, my mother, I am the second child, and I was due to be born in my father's birthday, 20 February. And that year, he God, he arrived to get his dream of his life, that was to buy a truck. And he bought a truck. And the truck was with carrying something ready to go, and I was not born. So he waited 1 day, 2 days, 3 days. The third day, he went for the trip. And he left my mother, and I was born the next day. So I came to replace something that was missing in my mother's life. That's important. In the birth, we can understand the mechanism when someone fits to fulfill an empty place inside someone. Like the mother has a need, something that she would like to get, especially love, attention, care, whatever. And usually mothers put the babies in this place to give them love. And it's not good. It's not fair. A child must receive love. A child is not someone to give love, but to receive. Well, and then my mother could not push me outside. And a doctor come to the room, examined her, and took her in an urgency to the labor ward, and anesthesia, and I was born by a forceps. So it was a trauma for me. First, I would like to be born, but my mother could not release me. My mother didn't, she was not able to push me out. She was retaining me. And so it's strange when you fight for life, you are eagering for life, but it's not happening. It's not possible. So someone comes to make it happen. And it was a doctor that saved my life. And this left some impressions in my life. So I started to think about becoming an obstetrician, justly to give to the women a respectful birth, a birth without intrusion, without unnecessary proceedings like episiotomy or C-section, whatever. In general terms, a respectful birth. And when I became an obstetrician, I found that I could find this in France, a training. So I went to Paris to be trained to do my first water birth and squatting birth and natural birth without any kind of anesthesia, birth without episiotomy, no episiotomy at all. And then after this training, when I was in Paris, I was bold. Can you imagine? I took the books of Michel Audin in French, and I wrote a letter to him, sending to the editors, French editors. I thought, as a Brazilian, it will never go to his hands. And for my surprise, two months later, he answered from London. He said, "Well, I'm living in London. If you want to come, you're welcome." I thought, "Wow, wonderful." Huh? And then I wrote to Le Boyer also, and Le Boyer answered me. And he was also in London.
Wow.
And so I went to London to meet Michel Audin. And I talked to him, and he asked me, "Where are you going to stay?" I said, "I don't know. I don't have a place to stay." "Oh, let me call." And he called Jen de Balascas. And Jen says, yeah, let the Brazilian come to here. So I stayed in her house. And then Janet presents me to Sheila Kissinger. And I made up a lot of contacts in London, in England especially, people related to natural delivery. And Yehud Gordon, an obstetrician in London that performs a lot of water birth. Well, these people. And then I had this contact with with Janet Balaskas. And then I come back to Paris and back to Brazil, started to working, and I went to England again in 1990, 3 years later, when I met all these people and I stayed 1 month in Oxford University, training for natural birth also. I went to several places, I visited several hospitals in London and in England in general, in Cambridge also. So that's it. Everything that was related to natural birth and I could go, I went to it. I went to learn and to become a good obstetrician, a respectful obstetrician, but we have to wait. We have to observe during the labor. But there's a moment when you have to act. Because if you don't act, you can lose a life. And if you act, you save a life. It's very subtle
It's like a
limit.
dance.
It's very subtle, the moment when I was in a home delivery, a home birth, the moment to go to the hospital, there's a moment to take this decision. So I went to get practice about this, all of this, and to bring security to my birth. And I went to Holland to learn about home birth in Holland. I went to Belgium to learn about water birth. So I was behind the professional that was inspiring me to be a better person, a better professional.
Which is interesting, is as if similar to my experience, the hard experience is as if that painful experience lead to something. No, because in my case was like my inability to get pregnant that made me study more about midwifery. My dream was always to be a midwife. And I remember when I was studying about childbirth education and all of that, womb massage, I spoke to my father on the phone and he said, did you know my mom gave birth to me at home and she was a midwife? And then I was like, no. He said, oh, and her mom also. And I was like, really? So I could feel that connection with my ancestors. But he was like, just a traditional midwife. I said, Dad, this is a lot. But the beautiful experience of seeing how something that can be so painful can also be so transformative. And I feel that medicine nowadays lack looking at us women and even asking, how are you doing? And this connects to your work about linking the emotional life, no, emotional body with the health issues. Could you talk a little bit about that, the connection that you make about emotions and gynecological like issues?
Well, very early in my medical practice as a gynecologist, I could observe that there was always behind a complaining, always behind a disease, some emotional conflict. For instance, one day came a woman with vulvovaginitis, candida. And she said to me, I've taking two pills already, 2 days, and I've used some vaginal cream for 4 days, but it's worst. It's increasing my itching and burning and a lot of things and discharges. Okay, let's do. Let's put some pieces here, like a constellation. And she put mother and father one side, husband and two sons in the other side. And said, and you, where are you going to be? And she put her looking to the father and mother. I said, well, I can see a child looking for her parents. You are not married. Your body is telling you that you don't love your husband. You are not in this family. You are still attached to your parents. So when you put this, she stayed. I remember these two children had been born in my hands. So
Okay.
she was my patient after 6 years. 2 years later, she divorced, and then she get 1 year later, she gets in love with another man, and now she's happy with this man. So disease is a way that the body uses to talk, to show us something that our mind, our conscious are not prepared to see. But if you have a pen in your shoulder, whatever, in the right side or left side, it's quite different, the meaning for your body. So I looked for these inspiring persons, inspiring professionals to help women to get the most extraordinary experience in childbirth. And my function, my mission was not to intervene when it was not necessary, just when it was exactly necessary to do whatever, even C-section, anesthesia, or episiotomy that I preferred not to do. That's the point where I developed my practice, to searching for this wisdom and at the same time science, experience and wisdom together to assist a birth in a healthy way.
Yeah, it sounds like it is really like it's not excluding allopathy because
No,
conventional medicine has its place, but it's how we can literally integrate both. Is that right?
exactly. I can take the better from allopathy. I can take in all the science. I can take the better from this side too and mix it together. That's the point. We're not when we exclude the ancient medicine, natural medicine, we are excluding a lot of knowledge that comes after centuries of observation since the Greece and India and many count Africa and Brazilian Indians. There's a lot of it's a rich field of knowledge in this medicine. So take this for the emotional body, for the mental body, for the body. These three bodies are together. So during the prenatal, it's the most important moment when I prepared a woman, emotional, systemic for her family, the meaning of the pregnancy, the fears and traumas about birth, and preparing the body with acupuncture, homeopathy, phytotherapy, and allopathy eventually.
Mm-hmm. Mm-hmm. Hi there, hello. So whenever you are thinking about, say, whenever the client comes, and then say, for example, she has, no, I know before you had given an example about cancer, for example. So if she's coming with something that I see here, a lot of women experience, like fibromyalgia, no, that excruciating pain. No, so usually people go, and then the doctors, a lot of the cases, a lot of the times, don't know what to say, don't know how to help. Either gonna recommend, exams, let's try to find what's wrong with the body, or then gonna give antibiotics or anti-inflammatory. But we know, again, a lot of the times it's not gonna give the answer. No, so what is your first approach when a woman goes to your clinic with a very, say, for example, a long time lasting complaint?
Okay, first of all, I make an evaluation about the symptoms, the exams, and diagnosis. Sometimes not accurate diagnosis. It's wrong. And it doesn't matter. It's just a stamp, just a label.
Uh-huh. Uh-huh.
Because the body don't read books, medicine books, to fit this in one of that. So, and then my crucial question is, what, after your point of view, the meaning of this complaint for you? What can you tell me? I know, I'm sure you have thought about this. So tell me, what the meaning for you? And I start with this.
Allowing the voice of the woman, basically.
Exactly. And see, which is the point for her after this complaining. So, pain, when you feel pain, uh, have you noticed that it happens after some happening in your life, some emotion, some food, some stress? Oh, yeah, I remember this. Okay. So, we start to understand the disease, the symptom, the high and low of the symptom, what increase, what get it better. And with this, I educate the woman to a relationship with the symptom. And first thing I say, would you have ever think to your disease? No. So when you feel a pain, first thing say, thank you for showing me something that I don't know. Thank you. Start to thank for your disease, because disease is not evil. Disease
It's not
is
against
trying,
you.
no, au contrary, it's trying to lead you back to yourself. To lead you back to yourself.
Mm-hmm. Yeah. Imagine if hospitals all of a sudden, that could be such a beautiful future if we could feel seen and heard, you know. And because I know we have done the live also in Portuguese before, so as I wanted to talk a bit about Betty Hellinger also, in whenever we did in Portuguese, you spoke a little bit about connecting to constellations. And what I liked the most was how you said, as a professional, these things were going on, but on a personal level, there was you needed something. So if was to give a message, to professionals that are just focusing on training, or mental knowledge, what would you be able to say, or which message could you give regarding that aspect of sorry, I don't know how to switch off that's not my clock watch. Which message could you transmit about that, about the how constellation, or not even constellation per se, but the systemic view, because I know that if professionals were looking into themselves first, they would be
Yeah.
much better professional. And a lot of the
Yeah.
trainings, they don't train that. It's ABC and it's by the book. It's not like, unless I heard that the other day, and the teacher was saying, if you don't look at yourself for constellation, is a post-graduation constellation with the Hellinger Schuler, and they were saying, unless you as a constellator look into your own issues, how are you going to be able to to address that in someone else? So which kind of message could you give to professionals in general, not only constellators, but anyone that works with health, especially you coming also from being a homeopath and studying Chinese medicine?
Well, I will start to remember the words of Hippocrates 400 years before Jesus Christ. He said in Latin, Médico, noce te ipsum e cura te ipsum. Traduzido, translation, heal yourself and know yourself. I think that is, and Khalil Gibran says, Master said to love my enemy. I loved myself and I won. So I think that the biggest adversary is inside ourselves. It's our ego that needs some time to be recognized, applauded, things like this. It's nothing. Because in the other life, in the spiritual life, what really counts, what really matters is how much love you have loved yourself, others, and the planet. It's not easy to love yourself because we have a lot of complaints about ourselves, self-judgment, guilt, shame, and many other emotions that are against ourselves. So respect yourself, love yourself first. To love yourself, all the professionals must have a daily practice of self-care, healthy self-care. First, love yourself. Love the others. Do things that you don't wait for anything back. You just give, waiting for nothing. It's
No
not an exchange.
expectations.
No expectation. It's not a change. Just give. It's not easy. Sometimes we give a hug and we wait someone to respond to our hug. It's not easy. But first, love yourself. Second, love the other. But love in a way that God has loved us, waiting for nothing, not judging, accepting the other exactly as it is, as she is, as he is. And so don't fight against the facts. Don't fight against what happened. Just accept. So love the others and love the planet. Try not to pollute, not to throw plastic away the way the world is full of plastic and so many things that are polluting nature. Try to build a better world with small practice, loving practice, respecting practice. I think that this my suggestion for every people. For me, first, love myself, love the others, love the planet.
Because I think that's what you were saying, was by you recognizing your own discomfort in your life that led you even to open yourself to constellation, so on. So the last question: do you believe if we are, as men, women, professional human beings, looked into, because I know you focus a lot on natural birth, if we all consciously gave birth to our children, raise children consciously, especially with the systemic view, do you believe that we would create a ripple effect, that it would speed up the possibility of our evolution, like the healing of this awareness of this planet?
No, the awareness is not everything. And the conscience, you can be conscious and don't change. The main thing is how much you love. If you want a better world, try to feel love for your children and teach him or her to love himself and the others. I think the love is the way, is not conscious, because even if you are conscious, you can be out of your center and not living a healthy or a loving life. So love is the biggest challenge, and can build a better world. And into love this way, you have to receive love from above, from the master, from the God, from God directly, with no priest, whatever. You receiving love from God. This way, it can feed your soul to be a better person, a lovely person.
It's like similar to what you're saying, like, say, for example, when someone is doing a constellation, but if they can even gain the awareness, but if they are not changing themselves, the posture, nothing gonna change. So
Exactly.
the same concept. So if there is this not awareness of love, this self-love, then they will stay in loyalty, they will stay in the repetition of patterns, because it does make sense. It's something that we don't talk about enough. We talk about love as something so superficial, but we don't even have this awareness of what is conscious love, what is blind love, and how much we are in this limitation all the time. It's yeah.
The point is how to get to receive love from God. This is the most difficult challenge everyone has to face, and ask for God to help us to receive his love or her love.
Which is beautiful because it's like the essence. It's where, even if we look back into our ancestors, what came before is connected to the source of it all.
Exactly.
Thank you so much. I'm very grateful. And like I said, maybe one day we do or either collaborate, or you're gonna decide to translate the language of the illness, of sickness that you have as a course. And I think this is also very, very empowering, for as a doctor, as a gynecologist, as someone that has been training and connect with so many people. We need that, we need more and more who is actually, I follow you for a long time now, and even to see how much you're constantly inspiring people to be healthy with your lifestyle, with your diet. Like you said, you're doing Qigong before this live, right?
Yeah.
And the health, and then you talk about intermittent fasting, so I feel that
Exactly.
we need professionals that are actually living what they talk about. You know, that they do that, and yeah. So I'm very grateful. Thank you so much for coming and for being patient of doing two lives. You know, the Portuguese and the English. So I hope that we keep connected and somehow we inspire other people with this work.
Yeah, I hope so. I hope we can do some work together and keep just living this love, and this love can change something, small thing in someone. This will be worthing to do whatever we do. So thank you for inviting me. It's an honor to be here, and I hope you have a nice day. And for our audience, for the people, um, I, I thank you for being present here.
Yeah, thank you. So, and also before you go, the book that we talked about in the beginning, Dr. Adailton translated from English to Portuguese. It's called Active Birth, no, and it is to help have a more humanized birth, more respect for birth. And also he spoke about Michelle Odan, Janet Velasquez. I never know if I.
Sheila Kissinger.
And then we also said about Le Boyer, how he also wrote a lot about nonviolent birth. Yeah, and a few others, but I think like who is interested in Brazil is called Partativo, né, o livro, and then in English is Active Birth, which we highly recommend people to, yeah, to read. Thank you. Have a good day. Blessings.
Thank you. Have a nice day.
Tchau, tchau, pessoal. Obrigada. Thank you.